All. This is Dr. Mubin Sayed from DrBeen.com. Welcome to one more show. So today what we'll discuss is the Novavax trial results for UK phase 3 and South Africa phase 2B. I actually love this vaccine. However, there is one thing that I am not super happy about, and we'll talk about it. Let's start looking at the vaccine itself. I actually really like this vaccine compared to many others. So let's see my illustrations and we'll go from there. And then we'll do a chit chat after this and we'll have lots to discuss as well. So here is the DrBeen. This is December when NIH said that hey, phase 3 for Novavax is starting in the US as well. This is the Novavax's press release. They do not have the data available yet. So all I could do was to use this press release. So this is really the data that they are offering. Then we'll look at some of the vaccines and cases as well. Novavax, if you are kind of interested in seeing how Novavax actually works, then I have done a video in the past which has the mechanism of Novavax. So it is the link is in the description. Then here, this is how also Novavax works. I have this link in the description as well. And then finally, some more data about Novavax. So these are the links. Let's start our discussion. Let's see. Vaccine type, it is a particle made up of spikes. So imagine if this pen in my hand is a spike, then I want to make sure that things are fine. Excellent. So imagine that this particle, this pen in my hand is a spike protein. What they have done is they have manufactured a number of spike proteins in insect cells. So no fetal cells are involved. And then they have put those spike proteins together. So it is really the spike proteins that make a particle. So it really looks like SARS-CoV-2 without the SARS-CoV-2's remaining parts. It just looks like a small hedgehog with all the spike proteins on it. And these spike proteins are what are injected in our body, and they are the one that act as a vaccine. So we'll talk about that in the test results. This kind of a protein is also called protein subunit vaccine. This kind of a vaccine is also called protein subunit. What does that mean? Subunit mean a part, correct? Protein subunit, that means out of the whole virus, there is a part of that virus which is a protein, and we are going to use that as a vaccine. So in simpler terms, let's say that the virus has a lots of hands, and we just make a lots of hands outside of our body and then inject those hands in our tissue, a very tiny amount. Name of the vaccine is NVX, COV for COV 373. Company is Novavax. This is, I think, their first successful vaccine. They have not had another vaccine launched before. Manufacturing is a recombinant technology. What does that mean? It has nothing to do with the fetal tissue. It is combined in bacteria, and then it is formed in insect cells. And I have done that discussion separately. So this is the first part, which I think is interesting for many of us, and that is that there is no fetal tissue cells involved in this vaccine at all. Then adjuvants. So this is the slightly less pleasurable thing for me. They have a saponin-based adjuvant called Matrix M. I talked about it in the last discussion as well. This Matrix M sometimes have been raised as a concern that this may cause issues. So they do have an adjuvant that may not have the best industry reputation, although the company is very, very proud of it. The company says that a tiny amount of this adjuvant actually allows a very tiny amount of spike proteins to be given, because adjuvant then goes and irritates the immune system instead of injecting a lot of spike proteins, and that then starts the process of the immune reaction and immune training. It is 2 shots, so that is another thing that I would have loved it to be single shot and be done, just like Johnson & Johnson. But it is 2 shots. And these two shots are 3 weeks apart, and the complete the protection is counted from 7 days after the second shot. So really about 4 weeks later. So one shot today, another shot 3 weeks later, and then at the end of the 4th week is the protection there. So it's about a month. Storage at the room temperature, this vaccine can stay viable for 24 hours. After that, it is spoiled. So if it is taken out to be administered for 1 day, it can stay fine. Otherwise, 2 to 8 degrees centigrade for 6 months. So that is normal refrigeration temperature. So it can stay okay for 6 months at the refrigeration temperatures, which is also good. So is it my favorite vaccine? Yes. Why is it my favorite? Of course, there is one thing on the J&J side, Johnson & Johnson, and that is they are a single shot. So I like that over there. And what is favorite of mine over here? Let me explain here in the next slide. So this vaccine has no messenger RNA. Again, messenger RNA is not a bad thing, but still there is no messenger RNA, there is no lipid nanoparticle, there's nothing like that. It does not have any DNA. For example, those vaccines that are adenovirus-based vaccines, these have a DNA that goes into our nucleus and then it gets replicated over there. This vaccine has no DNA at all. So the question of will it mutate our DNA and what would happen to the DNA that goes in our nucleus? What would happen to the mRNA that goes into our cell? So there are many people who are concerned about that. So these concerns, fetal tissue, no. Messenger RNA, no. DNA, no. And then it is not with the vaccine type being spike protein, it would still be picked up by the cells. And it is possible that some of the cells that will pick it up and that would shred it and display it, these will be killed by the natural killer cells or the neutrophils or the other such innate arm cells or even cytotoxic T cells. However, majority of this vaccine is going to be picked up by immune cells because it is a foreign material sitting in our tissue and it does not have a lipid particle around this to enter our cells. So what will happen is it is the macrophages and the dendritic cells that are and neutrophils that are going to come and eat it up. And so right from the beginning, the response starts from the immune system cells, and this is their function. Their function is to pick up the vaccine or not vaccine, foreign material and present it. So our immune system cell doesn't kill its own cells who are presenting the vaccine or the antigen because it is their profession. Because of that, the cellular killing is less in this. This is just like this. If we have a cop who brings in a person who arrests a person and brings him to the police station, we do not put the cop in the jail as well. It is cop's function to bring the people to the police station. So this vaccine is going to be taken up by the macrophages and the dendritic cells, and they are cops. So we don't kill them in response that they have arrested a vaccine. So very less killing of the cells that may exhibit or may have the spike protein. So from these point of views, I really love it. So how is this vaccine generally made? Here is a spike protein. So what they do is they take the RNA of the spike protein, then they give that RNA to cells, and those cells make spike proteins. Then they put those spike proteins together in the form of a particle. That particle is the vaccine. So it's beautiful. Now, the results for the phase 2B from South Africa and phase 3 from UK. So here are the results. Number one, this is according to the company. So again, please realize that the company's job is to be salesy about what they're doing. And I am taking the data from the company's website instead of data. So there is some salesy discussion here. So the company says, this is the first vaccine that has been shown to be effective against the variants or mutants. So UK and South African variants have been controlled by this vaccine. 50% of the cases in the UK, so the results that we are going to see today are UK and South Africa. So 50% of the cases in UK of the people who were vaccinated, and if they got the infection, that the virus was UK variant. In South Africa, 90% of the cases were South African variant. In the UK, the overall efficacy was 89.3%, which is pretty good. This is what I was waiting for. Now, if somebody gives me a chance to say which vaccine do you want, I would say Novavax. So 89.3%. And let's look at the numbers. 20,000 people in UK and South Africa, about 15,000 in UK, 4,400 in South Africa, now 16,000 here in Mexico as well. And there is part of the trial that is going on in the US as well. The goal here is to have 30,000 in US and Mexico, to have 30,000. Now, what are the results from UK? So this is UK phase 3. So total participants in the UK, 15,000. Their age was 18 to 84 years. 27% of the participants were greater than 65 years of age. And the primary endpoint, what were they measuring after vaccinating the people or after giving them a placebo? They were seeing PCR confirmed COVID. That was a primary endpoint. And the secondary endpoint was the severe COVID or death from COVID. So here is what happened. After the trial finished, or the phase 3 finished, there were total 62 cases of infected patients in the whole group. Half of them vaccinated and half of them placebo. What happened was, out of those 62, 56 occurred in placebo and 6 only in the vaccinated group. That is, again, that is beautiful. And this, remember, half of these patients were actually infected by latest UK variant. These 6 folks on the vaccinated side had mild or moderate disease, COVID, and on the placebo side, there were 56 people, mild and moderate, all of them, and 1 had severe disease as well. So that is a pretty cool result. And if you see here, this is the UK's result. So this is the wild type. This is the original Wuhan type squished. I hope you like this original coronavirus, the Wuhan coronavirus. So this is over here, and this was squished by this vaccine, and the effectivity was 95.6%. And then the new variant, if you see here, he has his goggles on and his bow tie on. So that was a UK variant. The new variant was 85.6% controlled by it. So efficacy was 85.6%, still pretty decent efficacy. South African variant will disturb us, will bother us. So let's see. Let's continue. So that was the UK result, pretty good result. South Africa, this is phase 2B. This is not phase 3. This is phase 2B. The number of participants here are 4,400. These participants included HIV positive and HIV negative patients. Age, again, 18 to more, and I think this number is incorrect. This is the UK. Same primary endpoint. Cases, so this is 4,400 patients. And then at the end of the phase 2B, the cases that they observed were 44. Now check this out. This is what disturbs me. Placebo, 29, vaccinated, 15. So efficacy is lower against South African. Once again, these 15 never became severe. And there was 1 severe in the placebo side. So that means the protection is, once again, from severe disease is good. Now, significant, this is their word, significant protection. And what do they mean by significant protection? 60% protection in South African variant. So it is not 89%, it is not 94%, it is 60%, plus protection from the severe. But please remember, this is also phase 2B. It is not a very large group anyways. So how was this structured? One third of the patients. So this is interesting. One third of the group, that is 4,400, were already seropositive with the wild type. That means they deliberately included one third of the patients. So maybe about 12, 1,300 people who were already infected, and they still vaccinated them and included them in the trial. Although the results that I'm showing, this is a very important thing, because when I read it, first I became bothered. I said, well, they have this one third of the people who were already infected. So they already should have the immunity. And even when there are variants, they should have less reinfections. And even then, the protection is only 60%. And here we have the 15 people got infected. So I became worried. But somewhere in there, so let me actually show you. This was, uh, I think these companies all, they're just trying to sell as well. So here, for South African variant, they say, here, importantly, in this trial, approximately one third of the patients enrolled, but not included in the primary analysis above. So this analysis that is here, it does not include the result from those one third. But still, when you kind of say that, hey, they were included, and then you show this result, not everybody is going to catch that, but not included in the primary analysis. And the result is you're going to say, oh man, even after getting the first infection, they are getting the next infection as well. Although they may be getting the next infection, but this gives a very higher repeat rate. So one third were seropositive. I am actually going to look at that data. Once they release the whole data, we'll see what happens. 92% of the events, 92.6% of the 44 people who became ill, they had the mutants. And that makes sense. In the South African, now the prevalent variant is the new variant. Just like in UK, the prevalent one is the UK variant. And then once again, they say, this is the first vaccine that has shown efficacy of up to 60% against the South African variant. So trials are now still continuing in the US and Mexico. In the total participants that they need for these two countries, US and Mexico, 30,000, 16,000 are already enrolled. I think 15,000 in Mexico and about 1,000 here in the US. This number may have changed since the publication. So this is the result. I like this vaccine from this point of view, that it doesn't have any RNA, it doesn't have any DNA, it doesn't have any fetal tissue. It doesn't have that possibility of entering the mRNA entering a cell and the cell making the proteins and then showing them, and then natural killer cell coming in and saying, I don't like you. It has lesser of that possibility. Directly the spike protein, direct trigger to the dendritic cell and macrophages, direct training of the immune system cells, and done. So that is how I like this vaccine more. How about I did this in 18 minutes. That's a record. So Sam says that US trial is fully enrolled. Excellent. So what happened? Is there someone named Wayne? Okay, so let's stop this discussion now, and then we start again with the chit chat. So please do me a favor. Please like, subscribe, and share. There is a link in the description for Patreon. There is another link for buying me coffees. And then there is another link for support as well. Margaret, thank you very much for your very generous donation once again today. So thank you, and thank you. All right. So once again, let's start, and do you want to do a chit chat today? Want to do a chit chat? Jim says, sure. Okay, let's do it. I'm going to hang up.